more compelling talk radio. 1320 WILS is live and Lansing with Dave Ackerley and the 1320 WILS Morning Wake Up.
Right now, we're going to talk about COVID-19 from kind of a health standpoint, especially for this time of year. It's cold and flu season, and you're not hearing much about the cold and flu. You haven't been. COVID has dominated the talks. That's part of it, but the other part of it is that flu cases have declined big time, partly due to COVID and, mainly because of some of the practices that we have undertaken with the mask wearing, with the social distancing, some of the things we've used to try to fight off COVID. Well, we're fighting off with the cold and flu as well. So let's talk about that a little bit this morning with Dave Johnson, healthcare expert, also the author of 2 best-selling books, Market versus Medicine, America's Epic Fight for Better Affordable Healthcare, and The Customer Revolution in Healthcare, Delivering Kinder, Smarter, Affordable Care for All. Good morning, Dave. How are you?
Good morning, Rich. I'm great. How are you doing?
Doing very well. Doing very healthy, I should say, as is the case with a lot of people who don't have COVID, because likely they don't have the cold or the flu. Is that a surprise to you at all that flu cases have been dropping the way they have here in the midst of the pandemic?
Well, it is until I think about it, right?
Right.
It's one of the beneficial byproducts, as you were saying, of better social distancing, better hygiene practices, and so on. The other thing that's going on is people are getting more flu shots this season. So manufacturers have distributed almost 200 million doses. Last year it was about 165 million. And so more people are getting shots. So it's those combinations. So the impact, the only state with moderate levels of flu-like illnesses is Oklahoma. All other states, including Michigan, have minimal levels. So you're right; it's very low.
Yeah, and that's an interesting point you brought up there too about the flu shots. More people are getting the flu shots. Is that because of what's been going on with COVID? Like if you take the pandemic, if you take the coronavirus out of the picture, would there be more people getting the flu shots, or is that happening because of COVID?
Well, it's been going up over the last 10 years, but Americans as a whole aren't great about doing this. About 45% of adults last year voluntarily got the flu vaccine. We'll see where the numbers come out this year, but they're going to be higher. But I think all of the attention paid to COVID, and with all of the great news about the vaccines that are just going into widespread distribution right now, and I think that's got people's attention, and let's hope we keep it going forward, because we're going to need it.
Yeah, absolutely. Do you expect kind of the practice to continue, this mask wearing, social distancing, everything we're doing to stave off COVID? Do you think that'll happen even, post COVID, like when the pandemic is declared over? Do you expect that we're still going to be, wearing the mask in public?
Well, the jury's out on that, but I will say, Rich, that if we as a country can collectively behave in a way that puts COVID to death, basically, or eliminates exposure for it to the country by the middle part of next year, that will be a remarkable accomplishment, and I think will win the attention of the nation and hopefully enlighten people as to the benefits of public health. We've really let public health atrophy over the last 15 or 20 years, and this is a chance, albeit under crisis situations, to show what public health can do for the people overall. And they seem to be responding. Americans seem to be responding. Higher percentages are wearing masks. I saw a recent poll that said over 70% of Americans now are willing to take the vaccine. A couple of months ago, as I'm sure you saw, that was below 50%.
Yeah.
So those trends are all moving in the right direction.
Yeah, and that's very important too. We're talking with healthcare expert Dave Johnson about how COVID has changed the cold and flu season, and with flu rates and flu cases dropping here dramatically. No, partially at least as a result of COVID. You mentioned the COVID vaccine and more Americans that are being that are willing to take it. From what you know, what's your take on the COVID vaccine? Because a lot of the government leaders that you hear, they're saying it's effective, and there are still some members of the public out there who are nervous about it. They're like, oh, no, I'm not ready to take that just yet. From what you've learned about the vaccine, what's your overall take on it?
Oh, I think what we've accomplished in terms of bringing a vaccine to market, a novel vaccine. There's never been a vaccine for coronavirus before. In under a year is a scientific accomplishment on a par with going to the moon or the Manhattan Project. And we're seeing results that are just incredible, 95% effectiveness. And of the 5% that do happen to get COVID, the disease is much less severe, much less virulent. And the other great thing about it is they're producing most of these vaccines synthetically. It's not the old-fashioned way where you would put a neutered type of the vaccine into the body and then trigger the immune response that way. They're actually manufacturing it using the body's RNA or DNA or other types of mechanisms. So the chances of side effects diminishes, and we're really seeing just terrific results. So the news on that front is terrific. Now, of course, we have the logistical challenge of rolling this out and getting over 200 million people vaccinated in order to get herd immunity, and that's like D-Day and the space station and Hands Across America all rolled into one. So
yeah,
it's
for real.
It's a major logistics challenge, but we're on it. So
yeah,
we'll see.
What do you attribute that to? This quick production, this quick distribution that you've had? Because, like you said, this is under a year. When you look at when the pandemic started, this is all happening in less than a year's time. What do you attribute that, kind of that fast response to? Any idea?
Well, it's a combination of things. There's been real advances in the creation of vaccines, new technologies, and so on over the last, say 10 years. But they had been sort of moving along at a deliberative pace. And when the need came, not only in the United States, but globally to scale up, I think United States and other countries have really responded. There are 400 vaccines, coronavirus vaccines, COVID-19 vaccines under development right now, 75 in trials and 2 that are out into the marketplace. So it was really, I think, good preparation, meeting absolute necessity, and then government spending the money, dedicating the resources to accelerate production. So it's on that front. The COVID story has been a mixed story in many respects, but on the vaccine front, it's been very impressive.
Yeah, absolutely, and of course we'll keep an eye on all the case numbers here, not just for COVID, but also the flu as well. We can't forget about, this is cold and flu season now. You wouldn't know it with the COVID pandemic, but we are here. Dave Johnson, healthcare expert, author of 2 best-selling books, Market versus Medicine, America's Epic Fight for Better Affordable Healthcare, and the Customer Revolution in Healthcare, Delivering Kinder, Smarter, Affordable Care for All. Dave, where can we find you online?
Our website is www.foresightshealth.com, and Foresight is the number 4 SIGHT health.com. So that's you can find us, and there's a ton of content if people want to read about reforming the very broken American health system.
All right, that sounds great. Dave, thanks so much for joining us this morning.
Well, thank you, Rich. Have a great day.